Substance abuse and the issue of addiction. Substance abuse is a social problem that permeates every aspect of human nature and society. The issue has become a public health concern that calls for intervention measures from all entities in society. This study looks at the issue of substance abuse and the problems of addiction. Sociocultural factors. Sociocultural factors in the society greatly influence drug use among the people. For instance, issues such as social networks, cultural backgrounds, and peer pressure not only determine substance abuse but also influence the specific types of drugs used in every setting. One of the social elements that determine drug use is group organization. Individuals in society may be involved in drug abuse to conform to the requirements of their groups. In this case, peer pressure plays an important role in influencing drug use among individuals. For example, the increasing trend of drug use among high school students in the United States is due to peer pressure. Family is another social aspect that determines substance abuse in society. Children who are raised in families where drug abuse is a common practice tend to emulate the behavior of their parents. Concerning culture, cultural aspects such as race, tribe, and religious affiliation greatly influence drug use in society. There is a disparity in drug use among people with regard to race or ethnicity. For instance, among the African Americans, the Amish and Mormons have lower rates of drug use due to strict cultural requirements on drug use. This subsequently reduces the rate of substance abuse among people. The aspect of religion also creates a disparity in drug abuse in society. For example, Christians tend to abuse drugs compared to other religions such as Hinduism and Islam, where drug abuse is widely prohibited. Islamic religion has strong regulations on particular drugs such as alcohol and nicotine. Moreover, cultural beliefs also contribute to drug use in the society. In Western culture, social events such as parties and other social gatherings must be embraced with some form of drug use. The aforementioned factors have led to widespread substance abuse in the society. For instance, in peer groupings, there is the element of anxiety that may contribute to substance abuse. Family problems such as financial difficulties and conflicts may lead to drug abuse as the alternative approach to reduce the level of stress. The direct financial costs of drug abuse include poor financial management, increased level of debts, lack of financial stability, and reduced level of income. Drug abuse also leads to increased healthcare costs for individuals and the government. On the other hand, the non-direct financial implications of substance abuse include a decline in economic productivity, lack of employment, and an increased level of poverty. The psychological costs of substance abuse include damage to the mind, since the chemical content of the drugs affects mental health conditions. Consequently, this leads to depression, low self-esteem, anxiety, reduced self-confidence, and schizophrenia. The physical costs of substance abuse include extreme loss of weight, abdominal pains, muscular aches, and exposure to chronic illnesses such as cancer and organ complications. The connection between drug addiction and crimes stems from the aforementioned problems. For instance, lack of employment leads to robbery among drug users to provide for their needs. Low self-esteem and lack of acceptance in society may lead to problems that are associated with interpersonal relationships or suicide. Dynamics of addiction. Addiction to substance abuse presents itself in different ways. Addiction may be repetitive due to pleasure, habit-forming behavior, tolerance, and desire. Addiction may also be compulsive, especially in circumstances where an individual lacks self-control. Addiction may also result from a web of attraction, which may be influenced by friends or peer pressure. This dynamic of addiction is controlled by the needs of the group. Defense mechanisms. Denial is the defense mechanism where an addict does not want to accept reality. The individual in this case acts like the situation does not exist. In denial, the addict does not embrace the fact that substance abuse is the cause of family problems or job-related issues. Regression refers to a state where there is a delay in a preceding stage of advancement. In this case, individuals who are overwhelmed with anger, stress, or fear may exhibit some behaviors that are meant to exempt them from normal activities. Projection as a defense mechanism occurs when the addict cannot identify the causes of various events in the surroundings. It is associated with memory loss or confusion. For example, in a family, projection occurs when the spouses do not have time for each other. Reaction configuration can be described as a defense strategy that stems from the transformation of dangerous unwanted beliefs. In reaction configuration, the addict may exhibit false impressions of the things in the surroundings. Rationalization as a defense mechanism involves the establishment of a correlation between every behavior and results. In this case, drug addicts tend to believe that they should abuse drugs to attain some objectives. For example, one may assume that alcohol abuse reduces stress.